Engaging citizens, a game changer for development? Bridging the gaps between citizens and governments, with Shirin Maiden, Associate Professor, Department of International Development and Department of Management, London School of Economics.
Jean-Paul outlined for you the gaps that exist between citizens and their governments. Here, I will expand on how ICT can bridge that gap. ICT-enabled citizen engagement, or e-governance, primarily refers to the usage of ICT to both increase administrative efficiency and improve the interface between governments and citizens by increasing the transparency and accountability of government processes. However, while both objectives are central to good governance, a key assumption to be questioned is the relationship of e-governance to human development. As we've seen in previous videos, by losing sight of the human development approach, many ICT-heavy citizen engagement initiatives have fallen short. Those that have placed a higher emphasis on strengthening local capabilities, however, have been more successful. Therefore, a more focused and nuanced approach is needed to ensure that citizens derive true benefits from investments in ICT. Demonstrating progress to higher-level bureaucrats and politicians by solely focusing on management information systems and data collection can result in a singular focus on the achievement of targets rather than a holistic approach for addressing real problems. Two case studies illustrate this. The first is the National Rural Health Mission, launched in India in 2005, which introduced a number of ICT and non-ICT accountability enhancing approaches aimed at improving the delivery of primary healthcare services. In Karnataka, a state in south of India, ICT mechanisms included an online health management information system portal and a beneficiary verification system with swipe cards for identifying, authenticating and monitoring beneficiaries. Non-ICT mechanisms included the establishment of village health and sanitation committees, which were village-level forums for conducting the community monitoring exercises. Of these approaches, which worked and which failed? Well, although technological capabilities made data more transparent, in this case it did not lead to improvements in data quality and, importantly, timeliness. Instead, it resulted in a reinforcement of traditional decision-making structures and ways of working that have evolved over time within the Karnataka health bureaucracy, such that these hierarchical structures glossed over local priorities, problems, challenges facing health workers in the delivery of services. In contrast, the village health and sanitation committees have become a key forum to mediate between primary health centres and the communities they serve. This committee currently provides a degree of financial and managerial autonomy to state and political actors, as well as to civil society representatives at the village level to address local health issues. In this example, it can be seen that a key aspect of improving accountability in primary healthcare will be to integrate the activities and knowledge generated within these intermediary village committees with the formal health planning apparatus. Our next case study comes from a different part of the world. In 2011, the Tanzania National Institute of Medical Research implemented a pilot project that gave internet-enabled smartphones to 10 village health workers per village, with the aim of gathering data for the Neglected Tropical Diseases Health Management Information System. Several supply-side factors influence the ability to gather this neglected tropical disease data at the village level. For one, there was a lack of internet access in rural areas, as well as frequent gaps in communication and poor maintenance of equipment, all of which threatened to undermine the programme. In cases where the network did exist, the majority of village health workers reported that it often took over 30 minutes to load or search for information from their smartphones. Nevertheless, there was widespread institutional uptake of the data that did become available, and senior health officers at the Ministry of Health at both the district and local level found the data collected to be useful for planning and decision-making, such as for finding out which villagers had taken preventative drugs, inventory control for distributing bed nets, and monitoring the activities of staff. There were also several demand-side factors that influenced the ability to gather data. On the one hand, village health workers using the mobile phone technology felt empowered that the data they entered went directly to officials at the district and national level, rather than through an intermediary. On the other hand, the mobile phone-based initiative was characterized by an upward flow of information from the household level to health planners, while the demand for information to flow back down to the village level for local planning and decision-making went largely unmet. For this two-way flow to occur, there needs to be support at the policy level through decentralization and local governance. To conclude, through the case studies Jean-Paul and I have presented, it is clear that two-way information flows, as well as integrating new information and data into existing bureaucratic systems tailored to the specific socioeconomic, political and cultural realities of local governments, are both critical in bridging the relationship between citizens and government. ICT-enabled initiatives, while powerful, cannot supersede these needs. In the next video, you will hear about the role of technology in recent large-scale citizen movements, such as the Arab Spring.